June is Myasthenia Gravis Awareness Month. Maya? What? Myasthenia Gravis. Or MG. Meaning, grave muscular weakness. It can get a little complicated, so let's try and simplify it. MG is a neuromuscular, autoimmune disease that causes rapid muscle weakness and fatigue of all the voluntary muscles. Basically, the muscles and nerves have a complicated love-hate relationship. But what does that look like in practice? Well, a person diagnosed with MG will experience that their eyelids start to droop and close. They will be unable to keep them open voluntarily, obstructing their view. The eye muscles start to fatigue and fail to move together, causing double vision and some serious headaches. Myasthenia gravis affects the voluntary muscles in the face. This means that we may look a bit grumpy and lose our sparkling smile. It also sucks that we might be minding our own business and suddenly start to develop swallowing issues, choking on our food and drinks. In addition to our tired throat muscles, we get tired of chewing, so we tend not to finish our meals, even if we're still hungry. Damn! That burger looks good. If you're a chatterbox, you'll have to tone down on that social calendar. MG affects your ability to speak and may even make your speech sound slurry and difficult to understand. Often, MG patients might even look intoxicated considering our droopy eyes and slurry speech. People often forget that the breathing muscles are voluntary muscles. But the lungs and diaphragm are also affected by myasthenia gravis. We can get so out of breath for doing the most simplest things. But here's the real ticker, and what makes myasthenia gravis a bit of an asshole. MG fluctuates in severity from day to day, but often, just for fun, from hour to hour. In addition, the combination of the different muscles affected also change, often and unexpectedly. This makes myasthenia gravis a very finicky and unpredictable neuromuscular, autoimmune disease. Exertion and activity worsens MG, and rest improves its symptoms. In practice, that means you have great limitations on what you can accomplish before you have to rest. You also have no guarantee that a certain amount of rest is enough before you can continue with, or finish a task. Myasthenia gravis is called the snowflake disease. It's called the snowflake disease because, like snowflakes, the representation of the disease is very unique in each patient. In fact, it can be very difficult to get the right diagnosis. We thank you for taking the time to watch this short video. Say it with me one last time: myasthenia gravis. This video is not intended to diagnose or to be used as medical advice.